So bladder and bowel problems are very common in MS patients. It is estimated that up to 80% of patients may experience bladder or bowel problems anywhere throughout the course of their disease. And for a variety of reasons, they usually are unreported symptoms, whether it's because patients may fail to recognize symptoms early on, or they might be embarrassed to discuss these symptoms with healthcare providers. In addition, healthcare providers, we are not very proactive in actually asking patients about bladder or bowel symptoms. Despite that, they are very common and they commonly affect other areas of patients' quality of life, including social interactions. Due to the need to use the restroom very often, patients limit their activities that they do on a daily basis. There is an increased frequency of falls in patients who suffer with multiple sclerosis and have urgency or the need to use the restroom in an ongoing basis. So for a variety of reasons, it's very important to identify as early as possible the occurrence of complications so we can address them and hopefully improve positively the quality of life and overall health of patients with multiple sclerosis. So in order to address that, it's important that patients understand the impact of these symptoms, and for that, we often recommend that patients keep a diary of their symptoms, trying to understand the frequency, the impact of these symptoms in their quality of life, but also any factors that might be associated with the occurrence of symptoms. For example, it's very often that patients have urinary urgency or frequency. It's important to know whether there are any other comorbidities, including infections, whether there are medications that patients started that may affect the occurrence of these symptoms, how patients are sleeping, etc. In terms of evaluation in the clinic, we have a variety of tests that we can order for our patients, including bladder ultrasound, laboratory blood work, and we often have to refer patients for a further evaluation with urologists. In terms of bowel symptoms, the most common symptoms are constipation and diarrhea. And again, it's important to understand whether there are any other factors that may be affecting these symptoms, including diet, including medications. For example, pain medications and sometimes muscle relaxants may increase the risk of constipation. So in order to have a true understanding of these symptoms, it's important to have a careful history, review the medications, and it's very important for patients to come prepared with a diary in order to understand the impact of these symptoms in their quality of life.